So here we are starting with a stakeholder roundtable, which is going to be a little bit different than this morning, in that we will have some very short statements, let's say, from the stakeholders that we have here with us, but then we will ask them also some questions. And you will get a chance to ask any questions in the end as well. So let's just start, because I think we have too many perspectives around the table, which is great, but we need to have the time to go through them. And first of all, I'm very pleased to have the co-chair of this roundtable, Estelle Ceulemans, who is a member of the European Parliament and of the Committee on Employment and Social Affairs. And Estelle will first talk about a little bit about her work and interest in this area, and then she will present the other stakeholders before we go on and ask them the interesting questions that are promised. So if I pass on to Estelle.
Thank you. Thank you very much. I'm very pleased to be here in the ILO also for this very important conference, the 10th of October, the International Day of Mental Health. I will briefly introduce myself. So I'm Estelle Ceulemans, member of the European Parliament, but maybe first I will precise that this is my first mandate at the European level. This is my first political mandate, because 2 years ago I was trade unionist. I'm a Belgian trade unionist, so it also means that working conditions and are for me very important. And during this mandate, as you mentioned, I have the chance to be member of the Ample Committee and coordinator for S&D in this committee. Maybe to say that at the beginning of this mandate in our committee, we have an agreement beneath 5 groups, the 5 no far right group, I would say, to have a broad list of reports and topics we want to work on. And we will have initiative report and non-legislative reports, but on the legislative program and scheduled, I have to precise that we will have one to ask the Commission to have an initiative for a directive on psychosocial risk. And I will have the chance to be the rapporteur on this initiative report. This is very important but we have 3 topics in this range of initiative reports concerning also mental health at work. We will first, and we are working now on the initiative report on IA at the workplace, and also a better framework for algorithmic management. We also want a directive on the right to disconnect, and also a framework for teleworking, and then psychosocial risk. We will begin with this work in the beginning of next year, 2026. Alors, why a specific directive? I won't tell you a lot about the evidence, statistic, numbers, and figure. You know that better than I. But voilà, there is a real pandemic all over EU and wider, and the work related to psychosocial risk and mental health at work are identified now as the one's priority for the future of work. During the COVID crisis, there is a great focus on mental health because the shift also to telework, and a lot of people had suffering mental health problem, young people, old people, workers, and at that moment it was okay not to be okay. And in 2022, the European Parliament adopted a resolution on mental health in the digital world of work. And in this resolution, there is a clear call for a new directive. In 2024, also, it's maybe important to mention, during the Belgian presidency of the European Council, it was also a high-level conference. And during this high-level conference, it was a statement signed by European Commission, but also by the social partners at European level. And it means also by Business Europe and SGI. This is the employer representative organization. They were also okay for to call and to have a new directive on psychosocial risk. Now we are 5 years after the COVID, and is it realistic to have to think that we will have a new directive during this mandate? We are now facing other crises at geopolitical level, and so, and it will not be so easy to have that kind of directive, even if we have the resolution and also the statement from the social partner, because now there is a new sense of urgency at political level, at European level, because now we are more talking about competitiveness also, and deregulation or simplification. And it will be a big fight also to have new regulation, to face new challenge also for the workers, because also of the white ring of the parliament, and also the lobbying of some Business Europe are really asking to have no new regulation and to have more deregulation on the existing directive. And by instance, the working time directive or the pay transparency directive are not really under attack. But we will keep on fighting in our committee to have new regulation, and as I mentioned, surely IR the workplace, algorithmic management, right to disconnect, and psychosocial risk. And last week, I had a very interesting also meeting with Roxana Minzatou, our commissioner for quality job, skills, social protection, and preparedness. At the end of the year, she will put, she will propose a quality job roadmap. Because if we are talking about working condition, psychosocial risk, we are also talking about quality job. So she will come with a whole proposal, a broad proposal for quality job roadmap, but for us, a roadmap is not enough. We really want clear regulation. And she announced also a Quality Job Act. For this act, it means that we will have hard law. At the moment, it seems that it will be on two very important issues, IA at the workplace and right to disconnect. But about psychosocial risk, she just mentioned a reinforcement of the existing directive and regulation. For us, it's really not enough, because you surely know also the framework directive from 89 and some other directive, but they are not working at the moment to face and really to prevent psychosocial risk. So we will keep on fighting to have a real directive, new directive and specific directive. So, and this year you maybe know that it will be EU OSHA. This is our European Agency for Security and Health at Work. They will have a campaign on psychosocial risk. So this is a very important support to ask for and to build my initiative report this year. And for this initiative reports, I will really focus on core issue, by instance, on individual and collective approach, because now the regulation, the existing regulation is too much about the individual approach. We really needed a collective one with a focus on primary prevention, because the most important is to have prevention, with an obligation for employer to systematically assess and prevent psychosocial risk with internal procedure. We also want a clear definition of psychosocial risk. Also, a recognition of pathologies resulting from exposure to psychosocial risk as occupational disease. I also will underline the importance of the prohibition or at least control of the merit order system. You surely know that kind of system that with evaluation on productivity based on goal and targets and put really the pressure and mental pressure on workers. Surely also a gender perspective because of the overexposure of women to psychosocial risk. Also underline the role of social partner at every steps and level, by instance, information and consultation of workers and representative, I mean trade union, regarding the implementation and follow-up of the measure adapted to prevent psychosocial risk. Then information and training, as well for the worker than for the management. Also, very important, the reversal of the burden of proof in favor of the worker in case he or she report exposure to psychosocial risk, as it exists in my country, Belgium, by instance. And specific process for harassment, as well psychological or sexual harassment and empowerment of labor inspector. But I'm sure we will have time, a lot of time to talk about this important topic. But I really wanted to tell you that from European side and from ample committee side, we really advocating hard to have that kind of directive. So thank you very much to let me the floor and to explain it to you in this very important conference. And then I let the floor to the other panelists, and I'm quite happy to see that for once, this is not really gender balance one. Oh, what a surprise maybe, as we are talking about psychosocial risk, but it's good for one that it's so many women and experts on that topic. I will first let all the panelists introduce themselves also, because it's quite important to put also all the nuance or who you are and what is also commitment about psychosocial risk. First intervenant is Nayla Glaise from EuroCadres, European organization to the blue-collar worker, I think. Yeah. Yeah, better.
Okay, so good afternoon, everyone. And I would like to thank you for inviting me to this very important event. I'm a trade unionist and leading an organization called EuroCadres, which is based in Brussels. It's an umbrella organization organizing professionals and managers. So our members are trade unions at national level that organize professionals and managers in the workplaces. We represent 6 million of professionals and managers in public and private sector. And we had run a campaign like 5 years ago now called EndStress.eu, calling for a European directive on psychosocial risks.
Our second panelist is Diana Gagliardi, Secretary General of International Commission on Occupational Health. Welcome, and let you the floor also.
Thank you, and thank you, Stavrula and the Academy for inviting me to this important panel, ILO for hosting it. And so I'm Diana Gagliardi, I'm Secretary General of ICO, that is the International Commission on Occupational Health, the most ancient professional organization in the field of occupational health and safety, founded in Milan in 1906 and still active with around 2,000 members across more than 100 countries around the world. We work with scientists and occupational health and safety professionals. So we bring together science, academy, and practice. And we do it also through the work of our 37 scientific committees dealing with all aspects of occupational health and safety. So a lot of work going on, and I will probably tell you more later. Thank you.
Thank you very much. And for our next and two intervenants, this is Leanie du Toit and Lachean Humphries. Sorry, I hope I pronounce it well. co-chair and manager at the International Organization for Standardization. But I will let you both introduce yourself, maybe.
Good afternoon, everybody, and thank you very much for hosting us and for inviting us. And thank you for the introduction. I am Leanie de Toit. I am the chair of ISO TC 283, the committee that is responsible for working on the revision of ISO 45001, which is the ISO standard for health and safety. I will hand over to my colleague, Lucky, to introduce herself. Thank you.
Thanks very much, Leanie. And I'd like to say thank you to the Academy for inviting us both along today, as well, and of course the ILO for hosting us. We're very delighted to be here on behalf of the ISO committee. My name is Lachean Humphries, and I work for the British Standards Institution. So we, in the UK, we have the secretariat for this piece of work. So I manage the committee on behalf of the UK. Thank you very much.
Thank you. And then, playing a little bit at home, we have Manal Azzi, team lead on occupational safety and health policy and system, occupational safety and health and working environment branch from the ILO. So,
thank you, Estelle. What a pleasure and what a group of expert women we have on this panel. So yes, I am representing the ILO here today. I lead the team that manages the global portfolio on policy here based in headquarters in the branch of occupational safety and health and the working environment. We are a few people here at headquarters and many more in our field offices. And part of our mandate and portfolio is the area of psychosocial risks at work. And we'll talk in a minute about our journey with psychosocial risk at the ILO. Thank you for having me on this panel.
So thank you. And last but not least, we have Sonia Noroka, a researcher on health and safety and working condition at the European Trade Union Institute.
Yes, good afternoon, everyone. Thank you, ILO, for hosting this event and Academy for organizing. It shows really the importance of psychosocial risks at work in the field of occupational health and safety and its priority for us. At ETOI, we're putting a huge importance on psychosocial risks in terms of research, in terms of policy advice, and providing a legal framework support, but also by empowering trade unions and transposition of scientific evidence into practice. And I will talk about it a bit later. But thank you.
Okay, thanks to all the wonderful experts on this panel. So let me start with Nayla. Nayla, would you like to tell us a little bit about the work of EuroCadres in this area?
Yes, so this work, as I said, started like more than 5 years ago. Actually, it started before COVID, then it was stopped, and then we launched it back again. We created this platform with 50 member organizations. Most of them are trade unions, but we have also researchers and some NGOs. And the common thing of this, of all these organizations, is that we want to work on psychosocial risk, but on organizational level and collectively, not individually. Because we, as Estelle said, that we have a lot of discussions on tackling psychosocial risk or mental health on an individual level, but what is lacking in the workplaces is this collective approach. And with this campaign, we started lobbying actually in Brussels with the Commission, the Parliament, and Estelle mentioned also that we had many reports during the last mandate of the Parliament calling for a directive. Actually, we had 3 reports calling for a directive on psychosocial risk. We have the European Economic and Social Committee also calling for a directive on psychosocial risk. So the only missing, I would say, party was the Commission, and still is, unfortunately. Now we have a completely different mandate, and it is, I mean, as absurd as this can look like, but we are struggling to maintain the victories that we managed to win during the last mandate, which makes a bit calling for a new directive a bit more difficult, but doesn't mean that we're not continuing this job, because as we have seen also this morning and yesterday, that this is more and more important at the national level. And this is why also we're pushing at national level. We have the Belgium presidency that organized a big event on this, pushing for a legislation on psychosocial risk, because we could see that the effect on economy is important as well. And when we talk about money, then employers can understand what we're talking about. So what I would say is, even though Ursula von der Leyen, the president of the Commission, said only last week that deregulation is the mantra of this mandate, even though which this makes our job difficult, but we will keep on calling for this. And I would want to mention one thing. Like we are in a situation where, in a very strange scenario, where we are so close, because we have seen a lot of evidence that shows the need for a legislation, where all the researchers and go in the one direction, which is not always the case when it comes to policy changes. Sometimes we have like contradictions with the researchers. Now we're so close, but in the same time, there's still a lot to do. So I would say that our main activity here is continue pushing, but also this is why such event is very, very important, because if I see only the list of one event, and we can see people coming from France, from China, from so many Spain, so many countries in the whole world, we can see that this is one event. We need to continue this work, because this is the only way where we can get a directive. So the challenge, I would say, here is to continue spreading this and broadening these, the outcome of these events, because we will manage to make it at a certain stage. I'm pretty sure we will. Because just 5 years ago, I remember this was my first day, I think, in Brussels, and we said, okay, let's meet with the key people in the parliament to talk about what about a directive on psychosocial risk. And I remember my first meeting there, and they said, oh my God, you're so ambitious. And my response was, no, I'm not. It's not ambitious. We need this in the workplace. And now we see that after that, we had like 3 calls from the parliament. We had the call from the ESE. We had the Belgian presidency calling as well. So we see that it's improving. It still needs some time, but it will improve.
Fantastic. Thank you so much for that perspective. I'll come back to you with some questions on that. But let me move to Diana for now. Diana, please tell us a little bit about ICO and how ICO has been active in this area.
Thank you, Stavroula. So first of all, I said before, we have 37 scientific committees in ICO. One of them is Work Organization and Psychosocial Risk Factors, whose chair is here in this room and will talk later. So I will leave the floor on what the scientific committee and ICO are doing in the field of psychosocial risk factors to Michael later. But ICO is engaged in developing and supporting science, also with the aim of contributing to a sound and efficient policy making. So we can do it by providing robust evidence that is created by our scientific committees. And this is more a transversal discourse, a transversal idea, because it applies to all the fields of occupational health and safety, and as well in the field of psychosocial risk factors, by producing important, relevant, and trustable evidence that can be used for policy making. Because policy making, to be efficient, to be effective, needs to be based on scientific evidence and needs to be also translated for the end users of the knowledge and the policy that will be provided. So our work is that of supporting the delivery, the production of science, and then the delivery of this knowledge that we produce in a way in which it can be used in the best way possible from those who need to use it to create policies. And this is something that applies not only to our, let's say, developed world. I mean, we have been listening today to a lot of experiences from countries where policies and regulations on psychosocial risk factors is really advanced. There are a lot of actions, activities, specific laws to protect workers against work-related stress, against the violence and harassment in the workplace. But we know perfectly that there are a large much larger number of countries where mental health is completely neglected. So there is where ICO can provide support to help in bringing the problem under the spotlight, and also thanks to the international cooperation to provide means, knowledge, science and instruments to create policies that could be applied also in these countries. Of course, this is a very complex way of working, but ICO, being a global organization with so many countries that are members of our organization, can really have an outreach that is that supports us in supporting and helping countries and regions where this problem is not yet addressed. Yes.
Fantastic, thank you very much. And indeed, I remember, Diana, psychosocial risk and mental health at work were going to be the key theme of the conference, the Congress in Melbourne. But unfortunately, the pandemic hit us. And then, of course, it was all about COVID when we met virtually, wasn't it? But Michael will tell us more about the excellent work later on of WOPs in this area. Thank you. Okay, and as I mentioned this morning, now we have other types of policies like standards coming up more. We have already 3 national standards, I believe, in the UK, in Canada, and in Australia. But we, of course, have an international standard. I'm delighted to welcome Lachean, who is going to tell us a little bit about the work of technical committee to on safety and health at work in this area. And I believe you have some slides as well, isn't it?
I do have some slides, but I promise that they will be brief. Great. Thank you very much. So you already know who we are. But I wanted to just give a bit of an overview of the committee and who we are and what we do and what we've published, just to kind of help frame the conversation for the panel as we get into it. So you can see on the screen there, I've got some numbers. The committee was established in 2018, which makes it quite young in the world of ISO committees. And it has quite a high level of participation across the ISO network. You can see the geographic spread in the map there. And in the 7 years that the committee has been running, it's published 7 standards, 2 of which I'll talk about briefly in a moment, and we have 4 more under development. So just a couple of points to keep in mind generally about standards. They set out agreed good practice. So this is for standards generally, not just OH&S standards. They can fill a gap if there isn't a legal requirement, or where there is a legal requirement, they can be part of the accepted means of meeting that requirement. So the use of standards is voluntary, also important to keep in mind. Sergio from the Ministry of Health in Italy, in his presentation this morning, had quite a helpful diagram that had binding policy and soft policy in it. So that's quite a good way to think about it, with standards contributing to the soft policy side of things. And the third point I've put on the slide here is kind of starting to think about how it could come full circle with standards. So the more that standards in general are used, and the more that the OH&S standards that we've published are used, the more we're seeing how they're being used by organizations. So what challenges, what successes are organizations having at that level? And that insight can potentially be quite helpful for policymakers and legislators. So what are the benefits of the OH&S standards? As you saw, the committee network is quite large. Everything we develop is by consensus. So ISO has quite a rigorous governance procedure, and standards go through a number of drafts, a number of rounds of public consultation before they're ready to be published. And the network of people that are in the committee includes people working at all levels of OH&S and representing tripartite expertise in OH&S as well. They can be published relatively quickly, so they take about 3 years. So relative to regulation and legislation, that is a little bit more. Is a little bit quicker, and they are, as part of ISO's governance, they're revised regularly as well. Stavroula, in her opening address this morning, talked about partnerships and speaking the same language. So I did just want to highlight the fourth point here, where connecting national OH&S cultures into the international standards arena. So both by using standards at that regional and local level, and by people at those levels being involved in writing the standards, it starts to feed into what is defined as the good practice in OH&S. So very briefly, I just wanted to put some information here about our flagship standard, which Leanie mentioned, which is ISO 45001. And I won't talk about it in too much detail, but just to say that it is what's called a requirement standard, which means it has accredited certification associated with it. And the fourth point there has some numbers. So just over 540,000 certificates. That's organisations at nearly 1 million sites globally, which makes it the third most certified ISO standard that there is. And essentially it provides a framework for managing OH&S, which includes leadership involvement and worker participation in planning, implementing, monitoring, and then improving an OH&S management system. And it does include mention of psychological health and safety in this standard, but not in any great detail, which is why we have a different standard, another standard called ISO 45003, which focuses on psychological health and safety at work. So this started development in 2018. It was the first project that was started by the committee once it was inaugurated. And as Estelle mentioned in your opening remarks, COVID did a lot to kind of change the landscape and how we were talking about psychological health and safety at work, and it became something that employers couldn't as easily ignore. So quite unusually for ISO, once the standard was published in 2021, it was made available for free for 2 years in recognition of how important it was to start addressing that for employers. So it's a guidance standard. It's not, it doesn't have an accredited certification like ISO 45001, which means that we don't have a number of certificates that we can point to as to how it's being used. But we're starting to get some insights in different ways, which I'll talk about in a moment. I won't go through this slide in detail, but I will just say that ISO 45003 uses a similar framework, well, it uses the same framework as 45001, so it can be used with that standard or it can be used on its own. But the bottom 2 points here, I think, are the more important to think about. And we've heard a lot about both of those things this morning and yesterday. But just to say that it focuses on the business case, so the case for employers to use the standard as well as the human benefits. And its emphasis is on the root causes, so not small reactive changes, but those systemic and long-lasting changes. For those of us interested in numbers, which I'm sure we all are, I've put a case study on the screen, which I won't go into, but this is a case study from BSI, so it's a UK case study, which you can go and have a look at on the BSI website. It's there for free. And this is, I've just got 2 more slides, and then I promise I'm wrapping up. I mentioned that we don't have certificate numbers to look at for 45003, but we do have insight in other ways. The top 2 here are new research, which is coming out of the University of Nottingham. Stavroula and Adicha and their colleague, Dr. Fiona Frost, who I know is involved in the Academy as well. Some research from the University of Tasmania in Australia. And we're also starting to see 45003 referenced by organisations such as Mind in the UK, which is quite an influential mental health charity. And Stavroula and Adicha very kindly said that I could put this slide in, and I won't go over every point here, but I did just want to pull out 2 things that stood out to me. And I'm sure you can ask them about this research in more detail, but the bottom left-hand corner there, legislative and regulatory readiness. So seeing some feedback through the interviews that people are using the standard to prepare for anticipated legislative changes. And the other thing I wanted to highlight on this slide was the top right, which is the employee perceptions, and seeing some of the feedback that employees respond positively to psychosocial initiatives, but especially when they're involved in shaping them. So that comes back to both the leadership involvement in setting up the management system and the worker participation as well. And that's all. So I hope that informs the discussion.
Thank you very much. And I think it was useful to have this information for those of us who have not known what is happening in the international standards arena. Thank you. And of course, now, well, the ILO has been very active in this area and regulation, and Manal is going to tell us a little bit about the different initiatives that the ILO has been active on. And I think Manal has a slide as well.
Thank you again. So we're playing sort of a role of listening today. So we're not here to really say an ILO position on psychosocial risk management. And I think it's part of the process that we are working towards, hopefully. But this is just sort of an historical overview of our relationship with psychosocial risks and workplace stress, even from the 90s and earlier. I think the joint definition that Aditya mentioned on yesterday with WHO, and how all of this falls within our normative standards, but also our occupational safety and health mandate. So back in the early 2000s, the ILO had a training package and still has the training package, although not proactive in promoting and using it, but it's there, and we do have some courses from time to time in our training center, and it offers and talks about a comprehensive approach. So for the ILO, of course, we stress, and we heard this earlier, about the focus on the organizational change and the organizational responsibility rather than the individual. That's key. And the focus is on prevention of occurrence of psychosocial risks rather than only dealing and supporting workers facing certain situations. But also it acknowledges that it's not, psychosocial risks don't work in a vacuum. They're part of other practices in an organization, but also part of health promotion. So not just prevention, but also about certain lifestyle issues. And this is how Solve was first featured, discussing issues related to financial security, economic security, violence and harassment, substance abuse, nutrition, physical activity, sleep. And so it was more about promoting health at the time, but this was just a training package, training of trainers. We also have the stress checkpoint. This is the second publication on the screen. I only have this slide, so don't worry. So the stress prevention is also one of our I don't want to say old, archaic, but it's one of those landmark publications sort of at the time that provides a checklist of, similar to a risk assessment and what we need to be looking for. But the thinking and science evolved since then, but these tools still remain available, especially for micro, small, medium enterprises where they're easy to use and easy to apply. And then with the help of some of the people in the room and some of the leaders, we were able to draft the first report in the context of the World Day for Safety and Health at Work 2016. And a lot of this was mentioned this morning by the Minister of Labour. She really went through all of ILO's work on psychosocial risks and mental health. And this report's objective was really to look around the world, like where are we in policy development, in regulation around the management of psychosocial risks, particularly in the world of work. And so it's quite a heavy documentation. Again, this dates back from 2016, but it was a good initiative at the time to start to see the lay of the land of regulation around this. The aim has always been in the background that we would hope and like to see the ILO come up with an international standard or an instrument. The ILO meaning our constituencies, ministries of labor, some of whom represented today, and employer representatives, worker representatives that would actually agree to recognize this issue and read all the evidence, informed information of how it is affecting our societies, our productivity, and our health and communities in general. And so the need for a global policy framework on this is important. We see that the ILO could be best placed to do that, as we understand the world of work, as we are workers, we are the employers, we are in our constituency, the governments that regulate this. So it would be good to work towards that. One initiative that we were able to accomplish was the adoption of a new convention on violence violence and harassment in the world of work, which was the next step a few years ago. And it was groundbreaking. And it was years in the making to agree on what that entails, who it covers, and to give proper provisions that would then be translated into national regulations. And important sections in that convention and its recommendation talk about psychosocial risk management and the need for a comprehensive approach to manage issues related to harassment at work, both internal to the workplace, between workers, horizontal, vertical, and also from third parties across various economic sectors. When we're talking about psychosocial risk, obviously we are all office workers, so it's not just for office workers. We hear about the high rate of suicide in construction, the different situations of workers in different circumstances, vulnerable situations, remote work, refugees, migrants. So the different sectors that we find these workers are also where, and this morning we heard a lot about job security and other non-standard forms of work and precarious work that also overlap. And you can't speak about mental health and not talk about the whole human and the whole work situation and security that a person finds themselves. Even more so today, as we redefine what work is, we redefine where we work, and we redefine the lines between our personal lives and our work lives. And we welcome in technology more and more, and we welcome new sectors of work and new ways of working. So all of that comes into play when we're discussing psychosocial risks. And also, if we look back at the time of COVID-19, it was also another time that gave us momentum to focus on the health and mental health. And again, when we talk about psychological health and psychosocial health, it's not separate from physical health. And a lot of the studies we see are linked to persons, living with certain exposures that then will lead to physical, gastrointestinal problems and other physical diseases rather than just a mental health impact. So it's a very broad spectrum of factors that lead to this. And so we were developing a global report on violence and harassment that touched a lot on legislation on psychosocial risk in this report, but it competed with launching our COVID-19 report on the same year. So we didn't really move it forward, but hopefully people have benefited from it, because even in applying Convention 190 on violence and harassment, while it started out to be an instrument about non-discrimination and discrimination-based harassment and violence, it does come back to the occupational safety and health, which is the more objective way of managing certain risks rather than grounding them in specific characteristics and discrimination-based discussions. It's more sustainable sometimes to look at the whole picture from a safety and health perspective. And we heard yesterday, when we were talking about our own UN mental health strategy and the call for a policy framework in the workplace. And that is the only way that it can sort of provide a framework and backup that's more systemic and not individual cases and case studies of certain situations, but rather that is where all our policies, from HR, we saw that earlier, from recruitment, from promotion policies, from appraisal policies, all of these are very important to ensure a safety culture and climate in the workplace. And so we had some work on teleworking and mental health. And our historical moment was, of course, the safety and health when it was included in our framework for fundamental principles rights at work. This elevated the issue of safety and health, and with it, it elevated mental health, because the two fundamental conventions, 155, 187, refer not only to physical health, but mental health, and the duty of employers to ensure such safe and healthy working environments. So that helps, and more countries are ratifying these conventions and hence have an obligation today to actually deliver at the workplace level. We work jointly then with the WHO for the joint mental health at work policy brief that clearly defines prevention, protection, and health promotion and support, with a big focus on prevention. Moving forward, our own global strategy that Joachim mentioned this morning, clearly there's an agreement that we will be working even more on something more substantial on mental health. We don't know the shape of potential instrument could be, but at least it's in the strategy for the next 6 years. The last thing I want to mention is that we are today in the process of developing a new and updated report that will show, sort of give an aerial overview of legislation around psychosocial risks at work around the world. And we are, of course, cannot do this, and we're doing this work in collaboration with many of you and many leadership in this room that have also helped us with their networks and associations to feed into this report, which is coupled with a global survey about this that some of you have even received. And we're hoping this report will provide some guidance based on practice and based on some of the informed evidence we already have, and give an overall comprehensive view of where we're at and where we could be going. And I think it would be a good concrete step in the right direction, in addition to what we hope this meeting will promote a global partnership, because none of us can do this alone. And we're very grateful and recognize the initiative taken by the European Academy, and to bring everyone, multi-stakeholder presence today for us is quite meaningful, so that we speak in one voice, recognizing the urgency of this issue, and hopefully we can offer this house, tripartite house, as a place where we can accomplish a lot in this area. Thank you.
Well, thank you. I mean, that was a fantastic overview. And it's also great to hear, of course, and publicize the forthcoming global report. I think that will be an excellent initiative that will provide further impetus for initiatives, whether legislative or other policy initiatives in this area. And Sonia, now come to you. Of course, the European Trade Union Institute has been very active in this area as well. So tell us a little bit about it. What have been some of your initiatives?
Thank you, Stavroula. Yes, I would like to tell you a little bit about the ETUI work in the field of psychosocial risks, and how we try to collaborate with many social partners from policy and academia through OSH institutes and trade union experts on occupational health and safety to build the scientific, legal, and educational foundations for stronger actions on psychosocial risks prevention in Europe. And within my presentation, I will talk about what we do and also answer a bit of the question of what are the opportunities or challenges that we face for the future work. As many of you probably know, over the past 4 years, ETUI has worked very closely with Professor Stavroula Lecha and Professor Aditya Jain to build scientific foundation for the future EU directive on psychosocial risks at work. And the science is very clear. Exposure to psychosocial risks can lead to chronic stress, depression, burnout, anxiety, cardiovascular diseases, musculoskeletal disorders, and it also has some major organizational consequences. As we heard earlier today, staff shortages, long-term sick leave, high turnover, and lower productivity. Yet despite all the evidence, the EU still lacks the specific and enforceable legal framework to address these risks. Our work with Professors Stavroula Lecha and Aditya Jain has focused on building that foundation, defining what psychosocial risks are, classifying them, and mapping how they affect health and organizational outcomes. Therefore, now we have the evidence that underpin the case for the directive. Furthermore, this work was a big support for the European Trade Union Confederation in shaping a clear and evidence-based policy position. Drawing on our scientific and legal expertise, we have contributed to ETUC's resolution that lays out specific demands for the proposed directive on the prevention of psychosocial risks at work. To name a few, but key demands, the resolution calls for a clear definition on psychosocial risks, the specific employer obligations to assess, eliminate, and minimize those risks, and the requirement for social dialogue, so that employers must consult trade unions and workers' representatives when developing preventative measures. As the European Commission moves forward with its quality jobs roadmap, how it was presented earlier, but MEP Ceulemans, ETUC is also calling for the directive on psychosocial risks to be part of this wider effort. A true quality job package must include legislation, investments, and programs that ensure fair wages, job security, good working conditions, work-life balance, equality, and of course, safe and healthy workplaces, both physically and psychologically. Building on ETUC's call for a directive, we also work with Workers' Interest Group in the Advisory Committee on Safety and Health, which is coordinated by my head of unit, Dimitra Theodori. And we successfully called for a mandate to establish a working party on mental health and psychosocial risks at work. And for those who are less familiar, the Advisory Committee on Safety and Health is a tripartite body that brings together representatives from governments, trade unions, and employers across all EU member states. It advises the European Commission on all occupational safety and health related matters, from new directives to strategic priorities, ensuring that social dialogue shapes every step of policy development. And within the Working Party on Mental Health and Psychosocial Risks at Work, we are working on 3 key tasks: to define mental health and psychosocial risks, to take a stock of data on the scale of this problem, including vulnerable groups and new forms of work, to gather and assess national and EU initiatives, and to consider future measures to address psychosocial risks at national and EU levels. This marks a historic step, which is a formal recognition that mental health and psychosocial risks are now a central of the EU occupational safety and health policy. In all of this works, the biggest challenge, which I would like to mark, is the constant opposition we face from employers towards recognition and regulation of psychosocial risks at work. As we have heard during this conference, promotion of mental health at work and prevention of psychosocial risks in the workplace is an investment which brings high returns with healthy, productive, creative workforce that is a fundamental block for any company. Unfortunately, the workers have been opposed to the Psychosocial Risk Directive, and we cannot really find a common ground to have that discussion, which I hope that maybe with the ILO input and this global policy framework initiative, we could have enforcement in this social dialogue between workers' reps, employers, and the governments. What I also want to mention is that, of course, having a law is one thing and making it work in a practice is another. Research and surveys across Europe consistently show that OSH legislation is the strongest driver for employers to take preventative action. And that is why we continue to advocate so strongly for a dedicated EU directive on psychosocial risks. But to be truly effective, a directive must be built on best practices, designed in a way that is clear, practical, and enforceable across all member states. In that context, we find ILO as a crucial actor to enforce the work and a global collaboration. And to support this effort, my colleague Otse Fayelo, who unfortunately couldn't be here with us today, together with Professor Leka and Jane, has led a major project mapping national legislation on psychosocial risks. And building on their work, our next project at ETUI will follow their steps, and we will continue that collaboration and analyze these national laws using the framework on psychosocial risks developed by Lachean, identify success factors and barriers in how these laws are implemented, examine how both hard laws and soft measures, such as guidelines, can shape workplace practices and draw lessons for the future EU policymaking. And through this work, we aim to bridge science, law, and real-world practice, understanding what works, what doesn't, and how we can build a strong and coherent legal framework for protecting workers' mental health across Europe. And finally, I want to point out that even best laws are useless if people don't understand them. Without awareness among employers, workers, and OSH professionals about what psychosocial risks are and how to prevent them, the law simply can't be enforced effectively. This is why ETUI places strong emphasis on training and capacity building. We are continually expanding our knowledge base and training center on psychosocial risks at work, and we continuously seek partnership in this endeavor. And together with EAOHP, we will now take the next step, building on our major research reports to create courses, webinars, and learning materials for OSH representatives, professional, HR practitioners, employers, and workers. This goal is simple but transformative: to create a shared understanding and a collective commitment to building healthy psychosocial work environment in every workplace across every sector. To conclude, the future of work requires that we treat mental health and psychosocial risks as essential to decent, sustainable employment, not as an afterthought. Evidence-based policymaking, tripartite cooperation, and continuous education are the three pillars to make this possible. At ETUI, welcomes the initiatives for the global network on the issue on psychosocial risks at work, and we are proud to work alongside the ILO and European Association on Occupational Health Psychology and all our partners to make mental health at work not just a goal, but the fundamental right for every worker in Europe. Thank you.
Thank you very much, Sonia. And also thank you you did actually provide quite a nice insight already on challenges and opportunities. I will go through my list of interesting questions that I promised earlier. I will ask all of you to be brief, okay? Because we have less than half an hour and I know some of you have to leave. So if I start with Estelle. Estelle, how can stakeholders best support the translation of knowledge into policy and practice in this area? We heard a lot that stakeholders are doing. What would you highlight as the most effective initiatives? What are the best ways to translate knowledge into policy and practice?
It's a huge question, but we really need all your input, as well evidence, because this is fact and figures. This is the base of good policy and regulation. We also need, how can I say, campaign, and surely the one of EU OSHA will be very important. So to support our perspective to have a real directive at European level, by instance. We really also need the input of the trade union and the people knowing the reality of the workers on the work floor, at the workplace, really. So I think all initiative, and we also need the academic world and support of academic world, even if you know that we are in a very dangerous world where the academic are more and more under attack also because they are not objectives. But no, we really need to be at all fronts to be sure to build a very good and regulation at European, but at also at world level. That's why it's that day is that kind of conference. It's also very important to have the input at every level.
And ICO, of course, has a long tradition in trying to achieve this.
Thank you, Stavroula. Yes, well, I think that knowledge translation is one of the most difficult and complex parts of policymaking, because it means providing science knowledge in such a way that the end user that may not be a scientist can effectively use it. So understand what we're talking about and use it. But on the other side, it is also important that researchers, when they develop science, start developing it in such a way that it will be useful. So I think that the knowledge translation process is a bidirectional process that needs to involve the stakeholders, that can be policymakers, employers, trade unions, workers, whoever will be the end user, since the beginning in the process of developing knowledge, so that the researcher will exactly address what is the question posed by the stakeholder of that specific question or point, and will also develop it in the science and the knowledge and make it available in a language that is easily usable by the end stakeholder. So it's a really, I think, double way process. And of course, identifying the right stakeholder for the specific point is another important point.
Thank you, Diana. And you know, we've discussed and heard since the morning different examples, of course, and in this roundtable of different forms of policymaking, regulation, the standards, other forms of policy, such as collective agreements. If I ask Manal, so Manal, of course, the ILO has done both. How do we achieve a good balance across the different forms of policies? Regulation and other softer forms.
So from an ILO perspective, our normative body is quite high level, and so requires that, you know, governments ratify the standards that are in the form of conventions, and then we hope that then they transpose the requirements in these conventions into their national regulations, and then have the compliance enforcement mechanisms in place to implement them, and the will at the workplace level at the duties that need to be put in place. So there's a clear, line of hierarchy of action. But I mean, it's also important for us to recognize, I'm sitting here next to ISO, and the relationship between ILO and ISO as, you know, as a voluntary standard setting body. And we do need to work together in the sense that our end beneficiary are workplaces, and these workplaces benefit from all these services. So we cannot ignore that they are getting different standards or certification systems. Our call would be that the process of developing voluntary standards follows at a minimum the consultation process and meaningful participation process and the values that the ILO tends to commit to in its high-level conventions and recommendations. And this is a discussion we continuously have. And, you know, there will come a day, I think, where we will be aligned and be able to work towards those objectives and work together, because our, the people who benefit from our services are one and the same. And so we do need to talk to each other in that sense.
Wow, and why don't we hear from Leanie now? Yes, since, and I purposely put you next to one another. So please tell us, what is your perspective?
Well, I deliberately didn't want to talk about accreditation because my background is heavy accreditation. So I thought I would rather listen to what was said over the last 1.5 days, and I'll sort of tie that together with what Manal has just said. I think what we do need to keep in mind is that regulations is underpinned by a legal framework where standards and regulations tell you what to do, but they don't tell you how to do it. This is where standards come in. Standards tell you, it gives you the steps, and it tells you how to do the specific task that is put in hand. I think what is specifically also important to remember is with standards is revised regularly. Like you mentioned it earlier on, every 3 years, where legislation and regulation isn't regularly revised. And if we look at standards as well, as standards, most importantly, are written by experts in the field. And this is particularly important. We heard about construction earlier on, Manal mentioned it, and yesterday we heard about healthcare. So for standards in this particular high-risk areas, it's quite important to have standards that are regularly updated. But for us to be able to make sure that it is implemented and it is the correct people are in the room, it's important that stakeholders such as regulators, such as policymakers and standard developers are engaged in an earlier stage. Otherwise, it is fragmented and we are reactive, we're not proactive. So thank you.
Well, thank you. I'll go back to the challenges. So for Sonia, the greatest challenge is employers' opposition in the development of policies in this area. Okay. Let me ask the same question first to Nayla, see if she agrees. What are some persistent challenges in the development of policies in this area?
Okay, so as I said, I mean, we have this big challenge of the whole atmosphere now with the deregulation, with the employers taking this opportunity. But I would say something. Yesterday, we heard a lot the word accountability. I should have counted the number of times we said this yesterday. I didn't, but it was mentioned many times. And I would say that we have data, we have evidence. And I do not totally agree that the fact that knowledge translation about this, everybody knows what is the impact of this work disorganization, I would say, and on mental health and on workers' well-being. So the thing is, when it comes to policy making, we should prove and prove and prove again and put a lot of evidence to make it change. But last mandate, we managed to have a directive on platforms workers. And if we managed to have this directive, it is because the European Court of Justice had so many decisions in favor of the workers. And this was the only way to get this directive. And what I want to say here is that we have the data, we need the legislation. The employers cannot say anymore, we didn't know. No, I didn't know that I had to put measures to prevent psychosocial risks. So now our duty as trade unionists is to go to the court. And we should not wait until another France Telecom trial, because this has a huge cost on humans' cost. And we cannot wait for this. So this is where it's also very delicate for us, because people that have had burnouts or even other disorders, it's so difficult for them to go to the court and to prove that this was related to work disorganization or work-related issue. But this is the job that we have to do, because if we don't have legislation, we need to make employers accountable, and we still have the court, luckily, in some countries, many countries again today. And I think this is one of the challenges, but it's a big opportunity also for us, because this is a way to get a legislation.
Okay, yeah. So okay. So in terms of this challenge, I'll come back to Sonia. You mentioned employers' opposition. Are there any other challenges? Do they impact your role specifically as a stakeholder, as a trade union actor?
Oh, it's for the threat. Okay. So yes, the challenge that I mentioned about the employers' lack of recognition and kind of stalking or slowing down the discussion on the psychosocial risks, and making it also very confusing in terms of like using different conceptuology and mixing the terms of mental health and psychosocial risks, and what are they really obliged to do in terms of protection of workers and eliminating psychosocial risks from the workplace. But another thing I wanted to mention, and I think maybe it's even more important in this at this event to mention, is that I think we do have quite a lot of discussions on psychosocial risks at work without mentioning the concept of psychosocial risks at work, because even at the policy level and also at the different disciplines in academia and research, we're talking about job quality, we're talking about decent work, we're talking about right to disconnect and platform work and telework. All of that has a foundation of a healthy psychosocial work environment, and we need to acknowledge that, and we need to kind of bring all of these disciplines together, like Aditya said, I think earlier today or yesterday, about this multidisciplinary need for a global network to just address the topic as it is and acknowledge that in many disciplines, we're using different concepts, different terminology, but we actually are talking about the same thing.
Okay, so, but do you see these developments as opportunities also? Like the Platform Directive, the AI Act, you know, other initiatives? You said a little bit about that before. Are they not also opportunities, or are they diluting the key message? How do you see it, Estelle?
One of the big difference between this mandate and the former one also is, you know, that we need initiative from the Commission to have real new regulation. We need an initiative from the Commission. And when you are looking to the mission letter of Roxana Minzatu, at the moment, there is no mention of new legal initiative. There's mention about right to disconnect and algorithmic management, but initiative on that side, but not a legal one. If you compare with the former Commissioner for Employment, Nicolas Schmit, in his mission letter, it was clearly mentioned minimum wage directive, platform worker, 6 or 7 new legislative initiatives. So that's also why it won't be easy to have an initiative from the Commission. Anyway, as I mentioned, we are waiting, it's already announced, for a quality job roadmap, but also a quality job act. In this act, it would be something legislative about IA at the workplace and also the right to disconnect, but nothing new, just an adaptation of the regulation on psychosocial risk. But for us, as I mentioned, this is not enough. So the first side and first difficulty is to have an legislative initiative from the Commission. And second problem, as it was already mentioned, is the lobbying of the employer at the moment. It is very aggressive, even on the legislative directive. Sorry, my English is not completely fluent. I try to do my best. Even on the existing directive, by instance, working time directive, and so and so. But what can we say against this lobbying of the Business Europe? Now, there is the motto of the competitiveness. Yes. This is very important. We have to be more competitive. And there is one big problem for this competitiveness, is that in a lot of sectors, there are a lot of shortages. So we are missing people in a lot of very strategical sector, not only healthcare sector, not only education sector, and this is very strategic also for the skills for the workers. And there is a lot of shortages. There is a lot of shortages because of the working condition, because of the psychosocial risk, because of the wage, but not only. So this is also, if we want to be economically and to be very competitive, we also have to take action against psychosocial risk and to promote very and real quality job at every level. Because also this is important for every sector. And this is also important for the employer because they are losing talent, as I said, and because also of the young worker doesn't want to work like slave in a very bad condition. They want to have a better balance between professional and private life. That's why we have to convince also the employer and the economic world to protect worker on that psychosocial risk and to have better condition and better wage.
And Nayla, do you want to, you talked about the opportunity, you heard what Estelle said, so the quality roadmap now, that has a big focus. Do you see it as an opportunity? Are there any other opportunities?
Yes, it is an opportunity. I mean, this is, somebody mentioned today that the psychosocial risk is, I think it's the first time in the EU legislation that it appeared. It was in the platform directive, actually. It's the first time we see this word in a directive. So now, why do we assess psychosocial risk only for platform workers? Why not for other workers as well? This is simplification for me. I mean, we have to do this. My concern is also when it comes to this roadmap, is that the Commission has sometimes tried to put everything in one basket. Okay, if you have something on the right to disconnect, then with this we resolve the mental health issues. No, psychosocial risk is not only about overconnection, it's also about other risk factors in the workplace. So this is what is a bit tricky in this new roadmap, is that we're trying to make the easiest thing to legislate on, and then when it comes to a big dossier like psychosocial risk, it might be like at the end of the day, we might not see anything about it because the excuse will be that we had the right to disconnect, then everything is resolved. So this is our job also, is to tell the Commission how important the other risk factors are other than overconnection.
Diana, ICO has worked many years with the ILO, the WHO to promote policy making and other stakeholders. What have been some challenges in this work?
Challenges. There are a lot of challenges, of course, and they vary a lot, I think, depending on also on the maturity of countries, on the maturity of the policy that we are discussing in different regions of the world. Because, of course, the perspective working with ILO, with WHO, and the perspective that ICO has is more broad than just Europe. There are a lot of challenges because, as we have said many times, the discussion, especially when we work with ILO, for example, in the building of conventions, is tripartite. And you need to bring together the vision, the needs, the positions of governments, of employers, of workers. And it's very difficult to find agreement. Sometimes it's easier. Some others, we have seen the discussion during the last ILC on the platform work convention, which is really not going on. So it depends, of course, a lot on a lot of different opportunities. As Sergio mentioned this morning, ILO and WHO used to have this joint committee meeting quite regularly until 2003, and that was a very important point of conjunction between policy making, I mean, bringing together legislation and regulations and the health aspects. So discussing the two aspects together and trying to make a synthesis of those. It would be really important to revive this kind of committee, even if now with the changes happening at the level of the UN organization, probably this won't be possible. I mean, I cannot see it possible in the near future. But in any case, international cooperation across different agencies and different organizations, including the ICO and other non-state actors, or anyway professional and scientific organization, is important to bring together the evidence base and the different perspectives from different part of the,
Thank you. Leanie, this is what is happening, this interaction across different perspectives when you develop standards. So you talked about that before, and you recognize as a strength. Are there any challenges in the development of the standards? How do you balance all this perspective, maybe?
I'm going to actually say something that I've heard many of you've mentioned today, because I think we all have the same challenges. It's time, it's clarity, and it's resources. If I look at my notes, especially that I've listened to this morning, it is where we've got stakeholders, when they are late, engaging too late in the day, there's challenges to get us back on track. So we are we're not proactive, we are, and the words it was, rather than being proactive, we are constructive. So early and open communication is what my take from this was, that early and open communication is important to ensure that the right resources are engaged. So whilst the timing and clarity and resources remains a challenge, not just for ISO, but I think for all of my colleagues within this room, effective collaboration and I think transparency can turn this into opportunities that will ensure genuine progress. Because if there was something, a takeaway I've taken away from today is there is a genuine want for progress. And I think this is the way forward.
Manal, this event has been about partnerships. How can partnerships be effectively built amongst stakeholders in the future? From your perspective, from the ILO, what would you like to see?
Yes, and even building on what Diana just said about how we used to work, the UN agency Division of Labor also, where WHO took leadership on science and research and evidence and clinical trials, and the ILO provided this policy tripartite governance with the decrease in resources and all of that, and the need to merge our expertise and what's remaining of our people and our departments. Where we're all treading on new ground, I think, and we need to find common outputs. And if I look at, the commitment we're hoping to have today, it's really based on if we all, decide on one or two clear outputs and work together. That's the only way we can have effective partnership collaboration, not just in words, but actually, keep our objectives very concrete and then work towards them. And you have some key ideas there from a common depository, because as we heard, so we have people in the room from very specific workplaces, small work, from multinationals, so not everyone is aware of everything on psychosocial risks yet. So we need to make all this information available to everyone and then go from there. And, we're heavily European also today, but, the rest of the world is not there yet either. So for us, from an ILO perspective, we need to make use of how developed, we find, your process has been, and bring it to those who are left behind. We get stronger by getting all of that information from other regions as well. So it's more, let's find a few common outputs and work towards them together.
Well, thank you. And of course, in your folders, you have a draft of a global partnership agreement and network that you can read at your own time, that we will sign later today among the key scientific associations that are present here. And of course, one of these remits is to support the ILO in this important work that they do. Okay, we started about 15 minutes late. We are just finishing on time, but I would like to open the floor to some questions from the audience. Yes, please.
Thank you very much for this very interesting panel. I have many comments, so instead I'm going to ask a very provocative question, especially on the World Mental Health Day, and then I'm going to explain why. The question is, isn't it time to delink psychosocial risk factors and mental health? The reason why I'm saying that, and I see Ms. Navarroka nodding, is, well, I've heard Ms. Glaise saying we know the consequences. And from what I've heard today, we know the impact, but I'm not sure we really know all the consequences. And I think Ms. Nabroka has listed them, saying that not only psychosocial risk factors have mental health consequences, but they also have health consequences. And she listed cardiovascular disorder, musculoskeletal disorder. I've also heard gastrointestinal disorders, and probably, well, I would make an assumption that I really believe in. I would say some forms of cancer. The problem is, I think we are counting apples and pears in the same basket when they should be in different baskets. And I've heard very interesting thing this morning about counting the sick leave days. It was in Finland, counting the sick leave days for mental health reasons. And to be really honest, well, mental health reasons for sick leave could derive from psychosocial risk factors, but they could also derive from mental health conditions such as schizophrenia, bipolar disorders. Well, a lot of sick leave would be related to cardiovascular disease, but we don't know the part of those that are related to psychosocial risk factors. And I would say same thing for a lot of different disease categories. Well, hearing all of you, I would say from a very layman point of view and a clinician point of view that we need there's a lack for a common terminology and a common definition of the consequences, especially when I hear, for example, and it's clearly not an insult, but when I hear burnout, well, as a physician, I don't really know what we're talking about. Well, for example, and I think it's time to separate all the psychosocial risk factors and list the consequences and attack the consequences one by one. Meaning that, for example, I see a lot of victims of moral harassment. Well, they present with post-traumatic symptoms. I would even call that a workplace PTSD. So, wow. Well, I want to stop because I'm going to be too long, but
I think Sonia can reply. I would direct you to a major report that the European Trade Union Institute published last year, where we have a review of 800 systematic review and then meta-analysis studies, very strong methodologically, that show the impact of psychosocial risk on various health outcomes. And I think this is what the evidence he was talking about was mentioning. So I would ask that you read it. We have the link, the slides have been shared, and you have the link there to the European Trade Union report. I would ask that you go there because we have hundreds and hundreds of pages of very high quality studies, epidemiological studies, that show actually that there is this kind of impact. I don't know if you want to add anything to that.
Yes, I would like to thank you for your question. And yes, Stavroula is very, very right. This is exactly what we're working on at the European Trade Union Institute together with Professor Stavroula Lachean and Aditya Jain. But yes, at the same time, that is also what we're advocating for. We need a clear definition of psychosocial risks, and we need a clear definition of mental health at work. And we need to separate the debate based on the definition, based on the consequences, but also based on the employer's obligation towards psychosocial risks and mental health at work, because those are different obligations that we're talking about.
And I think, Nayla, you want to add something?
Yeah, please. Oops, does this work? Okay. Just to be clear, in a EU directive or whatever policy or legislation we want, we're not talking about consequences. We're not defining consequences. We want to prevent the risks. Yeah. We don't want to go to the consequences. So this is our aim in a directive, is to make prevention and primary prevention, because we're not defining at all the consequences. But the consequences are here today. And what I said when I talked about the burnout is that while we don't have any prevention in the workplaces and there are consequences, we should go to the court of justice and make employers accountable. But in a legislative text, we're not talking about consequences, because this is the aim of this text, not having consequences.
Diana and then Michael, and I want to see if are there any questions online? There is one. Okay, we'll go to that.
Just want to add to what Nayla said, that when we observe the consequences, it means that occupational health and safety and its real scope has failed. So what we want to do is prevent, exactly. So, but we need to know, when we do prevention, we need to know what we are preventing, and we need to know the consequences to avoid that they happen. So,
Okay, Michael?
Thank you. Just a short comment. It has been mentioned that in the European Platform Work Directive, which was passed just 1 year ago in October 24, which has now to be transformed into national law, for the first time, psychosocial risks are mentioned. So this is an evolvement of the European legal framework. Maybe this initiative, this fight, this campaign for a overall psychosocial directive could build on that and then evolving. So there is some progress, slower than many of us hope, but it is visible, and maybe you could build on that. That's my.
Estelle, any reflection?
That's really true and right, and it's the same with this directive. You have the first time also a framework for the algorithm management, and now we are in a situation that we have to say it exists at least for the platform worker. It have to be also the same for every worker. This is the situation we are in now. At least to say if it exists for those workers, it have to exist for all the other ones. This is really right, and on what we have to fight. Yeah.
Miguel, what is the question online?
Can you hear me? Yeah, perfect. Thank you. So it's from Juliana Oliveira from Brazil, and she wants to hear about the impact of psychosocial risk in the occurrence of accidents and impacts going beyond mental problems.
Okay, in the interest of time, I will direct also Juliana to this report that was published by the European Trade Union Institute. You will find a lot of evidence also in this area there. And the report, the link has been in the slides of the event that will also be shared with everybody that has participated. Okay, I think we managed 10 minutes. Thank you very much to all of you. It was a very interesting roundtable. We really appreciate your participation, and we look forward to seeing you again in other events of the Academy in the future. Thank you.
Thank you very much.